One of the things we're also working on, which I saw that you were interested in finding out about, is the public procurement process when it comes to buying medications and buying medical equipment for different facilities. Right now, what we did was in 2015, there was a law passed in the parliament where the procurement, national procurement of medications and medical devices was handed over to international organizations. Those international organizations that are working with us now are UNICEF, UNDP, and Crown Agents, which is a British national company. And these three organizations do all of the purchasing for the national procurement of medications. In Ukraine, we procure vaccines on a national level. We also procure a lot of cancer treatment drugs and treatment for very expensive treatment for diseases such as hepatitis B and C, and also heart disease. So there's a lot of procurement done on a national level. And until 2015, there was a lot of corruption involved in that procurement. The tender processes were closed. There were only very certain consortiums of pharmaceutical companies and companies that made medical products and importers and distributors that were allowed in to come into the tender process. And a lot of money was made by those corrupt schemes by officials in the government, as well as by not the most honest companies. When we gave the procurement over to the international organizations, all of that was removed from the system. Now the Ministry of Health places an order of how many vaccines we need, how many of each of the different medications we need, how much of the medical devices we need. We hand it over to the international organization that then opens up the tender process on the world market. And Ukraine gets the best prices on the world market to buy all of these different medications and devices. They're purchased by the international organizations. They're delivered into Ukraine. And then the Ministry of Health distributes it to the regions where they're needed. So the entire corrupt process of the procurement was taken outside of Ukraine. We don't want this to be forever, though. We don't want the international organizations to always be in charge of our procurement. So at the same time, in parallel, we're working with different organizations, including USAID and UNDP and UNICEF and others, to create a Ukrainian organization similar to the way UNICEF buys vaccines. They have a procurement agency within UNICEF that has procedures in place on how they purchase vaccines for almost every country in the whole world. We're using their model to create a Ukrainian-type procurement agency, a Ukrainian procurement agency that will be similar to those that are in these other organizations. And parallel to taking procurement out of Ukraine, we're creating an entire new independent agency. In 2020, we are to bring back procurement into Ukraine. This agency will be functioning by 2019 and 2020, already starting the procurement process for Ukraine. And that procurement agency will be open to the world market again. So not only will it be able to purchase the medications we need here for Ukraine, but it will also have the opportunity to purchase Ukrainian product and sell it on the world market, which is very important because we want to help Ukrainian business to grow. And we want the honest pharmaceutical companies, the quality pharmaceutical companies that are here in Ukraine, the ones that make medical devices, to get out into the world market. And so we're helping them to get up to Western standards so that someday they also will be able to sell their product in European countries rather than Ukraine always buying from other countries.